Now we're going to pivot to Obamacare. In a few minutes, we're going to take a look at the politics involved in trying to repeal it. But first, the human toll it could take on our area. Now, this Hudson Valley resident explains how the Affordable Care Act has helped her and her family.
By signing up for the ACA, we have saved in the neighborhood of $400 a month over what we were paying last year.
Okay, this doctor says it's also helped one of his patients the following way.
I spoke to one of my patients, as a matter of fact, just recently, who was one of the most elated recipient of Obamacare, because I was taking care of her for free, and she knew that what we could offer would be limited. Once she got her insurance, she was just super happy, and she started to taking care of herself.
Now, obviously, not everybody doing cartwheels over it. It was a huge political issue in the campaign. Some people have complained, certainly about premiums, doctor choices, etc. But the numbers don't lie in terms of those who've signed up and the rate at which they've been signing up in the last few years and even the last few months. It's a big deal, especially when you look in New York State here, the impact that it's had. Governor Cuomo's office says if, in fact, it were repealed, nearly 3 million New Yorkers would lose their coverage, and it would cost the state nearly $4 billion. That's with a B. Looking locally, 92,000 Westchester residents now covered by Obamacare and 39,000 in Rockland. In each case, it's about 10% of the county's respective populations. Now, we're going to be following the health care issue as it moves through, the repeal, what it could be replaced with, etc. And we'll be taking a look at it from every angle, looking at how patients, most importantly, are impacted, doctors dealing with it, affecting insurance companies. But today, we're going to start with hospitals. Now, my first guest, he spent 17 years as CEO of Riverside Healthcare System. It's a group that operates 4 major care facilities, in many cases, some urban areas, including St. John's Hospital in Yonkers. Jim Foy, he joins us. Okay, how much are folks, heads of hospitals, how many bullets are these folks sweating over what a repeal of the ACA would look like? Is what's scaring them what it will be replaced with, or is it the unknown?
Well, I think it's two things. First, it's the unknown. What we do know is that if the Affordable Care Act is abolished, you're talking about 22 million Americans and almost 3 million New Yorkers who would lose their health insurance. Those numbers are huge, as our president would say. But on top of that, New York State would wind up losing about $4 billion a year in revenue that it gets for the expanded Medicaid program. Some people think that the Medicaid program is for people who can afford something else. What they expanded Medicaid eligibility to under the Affordable Care Act is families of 4 that were making less than $34,000 a year. So you're not talking about people who have any significant savings or have a high enough income to have another option. You put on top of that the damage that that'll do to hospitals. People forget also that hospitals contributed almost $300 billion in reduced Medicare payments to make the Affordable Care Act possible. On top of that, what they're talking about now, if it was repealed, it'd be about $160 billion more. And people say, well, there's going to be a replacement. I haven't seen a plan yet. I don't know if you guys have seen a plan, but the only 3 ways that I could see this being paid for would be either, number one, big new taxes, which doesn't seem to be a starter in a Republican-controlled Congress. Number 2, reinstituting the tax on people that was made in terms of the penalty if they didn't get health insurance. Again, another non-starter. Or else a dramatic reduction in reimbursement rates to doctors and hospitals, which, New York State now has about 30 hospitals that are on their critical red list that they think are in imminent danger of closing. I think 2 of them are in Westchester, as a matter of fact. You talk about this on top of it, those places would close so fast it'd make your head spin. So I think it's the biggest thing that hospital execs have been facing. I spoke to my successor, Ron Cordy, at St. John's yesterday. He said he's never seen anything as threatening as this is to St. John's in his time, and he's been working at St. John's since 1990.
And to couple it, Jim, you got the insurance industry that's trying to figure out what the heck they're going to do, and you would imagine if they start repealing this without a clear replacement, and like you, we've seen nothing that offers any kind of clarity, they're going to start exiting this as well here. You're talking a cluster, you know what here that will be very fast approaching. Now, the Journal News, they did a really interesting piece, and it surprised me. Well, people say, oh, you know what, you're probably talking the biggest inner cities that you'll find it. Well, you know, in Westchester County, 100,000 people roughly are on this thing, including more than 10% of Scarsdale's and the rest. It's not enough just to throw a blanket over that, oh, well, you know, people, they'll just keep going back to the emergency rooms like they used to before this thing came around. A whole host of people have signed up for this in a big hurry. I think it's 22% up just from last year because the previous alternative didn't work, right?
You're absolutely right. And on top of this, we forget that the Republican majority in the House and the Senate has put forth two changes to Medicaid and Medicare. They're looking to privatize Medicare and to replace Medicaid with block grants. Let's call that for what it is, reducing the money spent on both of them, which will force people off the program, make our senior citizens and poorest folks pay higher copays and deductibles, and reduce health care. And this is separate and apart from the Affordable Care Act. You're talking about a health care crisis that would be coming out now without a plan to fix it.
Beyond this, there is trying to put a human face. Jim, if they repeal this thing and they say, oh, we'll just go back to the way it was when we had 50 million people without health care, et cetera, give an idea on the kind of people. I know you've done a lot of work here in the last 10 years with people who suffer from substance abuse. There's so many layers to this. Give an idea to people out there, things they may have taken for granted the last 4 or 5 years that now all of a sudden get put back up to the forefront.
Well, I mean, the best analogy I see is what those of us who were in our 60s, like me, regrettably remember. And that's what happened when they closed the shelters for the mentally ill in the late 80s and early 90s, and it created the homeless problem that we dealt with. You're going to see this, only on top of this, it's going to be people who have a significant addiction to heroin, other opioids, prescription meds, who are going to have no place to go. Medicaid pays for most of this, and that's getting cut to heck. So, I mean, the police department is going to have a huge issue. When we're talking about reducing prisons, you're going to have an increased demand for prisons when people have to rob and break into houses to fix their habit because they can't get treated for it. You're going to have diabetics who are not able to go to a private doctor to maintain their health while they have diabetes, and they're only going to show up in the emergency room when they wind up in ketoacidosis, or they're in a coma, or they have to lose their arm, or they have to lose their leg. We're going to be treating things at the last moment. It's going to be more expensive, and it's going to be our neighbors who are going to wind up becoming disabled from their diseases or actually die from the diseases instead of something that could be treated earlier.
We did hear one thing, without any specificity, Jim, from the president-elect who says, hey, listen, everybody under this new plan, they'll all be able to keep their insurance. You get to have, in effect, what I call the dessert part of this, that if you have a pre-existing condition, don't worry about it. You'll still be able to get insurance. You can still stay on mom and dad's policy till you're 26. There's no way that at least I've seen, or the folks I've spoken to say, that remotely adds up from a math standpoint if you've decreased the revenue from all the healthy people participating that are part of this exchange. You can't have it both ways, can you?
Absolutely. And if you look, some of the problems that the Affordable Care Act has had in the last year or two has been because, as part of a compromise, they reduced the penalty, and a lot of healthy people didn't sign up. If you eliminate the penalty, if there's no requirement that people buy insurance, it's going to be significantly worse. The numbers don't add up, and that's the scary thing, that they're talking about repeal and subsequently replace. They can repeal it, it seems. They have the numbers to repeal it, but they don't have a clue in terms of where the dollars are going to come to replace it, and they're significant dollars.
Finally, Jim, and I'm not, this isn't about scoring political points here, but for anyone who thinks the consequences of a full repeal with a less than adequate replacement really won't be felt by anybody, you're saying no. And it's not just Democrats, it's Democrats, Republicans, it's really everybody, middle class and below. They'll feel what we're hearing could be, in effect, the replacement for the ACA, right?
Absolutely. And in Westchester, you'll see a couple of less hospitals. You'll see doctors going out of business quicker than they normally would, which we've already seen happening. And you'll see people with chronic diseases having the worst outcomes, and it'll be your neighbors. It's not somebody a million miles away who's a bad guy. It's your neighbor. It's your neighbor in Scarsdale, as you said. It's your neighbor in Bronxville. It's clearly your neighbor in Yonkers or New Rochelle.
Jim, I have a feeling we'll talk again soon here once we get a clue as to what's happening, but the repeal already underway in Congress. Jim Foy, I really appreciate you making the time. Thank you so much.
Thank you very much. Have a good day.
And coming up next, we're going to get into the politics of Obamacare with the table. The president wants to get rid of it, and so does the Republican-led Congress. But a whole lot of governors, including Republican governors, say not so fast. We'll spell out how this whole thing may just play out.